Well, good morning, everyone. Thank you for joining us here at the Community Vaccination Center in Greenbelt, Maryland. It's a beautiful day for a press conference, and I'd like to introduce our speakers. First, we'll have Governor Larry Hogan. Next, County Executive Alsa Brooks. Next, Health Secretary Dennis Schrader. Brigadier General Janine Burkhead. I will speak after the General. My name is Chaz Eby from the Emergency Management Agency. And finally, Mayor Byrd and FEMA Administrator Janice Barlow. But first, it's my pleasure and real honor to introduce the Governor of the State of Maryland, Governor Larry Hogan.
Well, thank you all very much. This is an exciting day, a beautiful day here in Prince George's County. It's great to be back here and to be opening another mass vaccination site. This time, it's thanks to the efforts and the partnership of FEMA. We can't thank FEMA and the entire federal government team enough for, first of all, choosing a site here in the state of Maryland, right here at the Greenbelt Metro Station, which is terrific because people can access the site very easily. We're pleased to be here with County Executive Alsa Brooks, who's been a tremendous partner throughout this entire crisis. I'm proud to be with the whole team here from the Maryland Department of Health, Maryland Emergency Management Agency, Maryland National Guard. It's really, they say it takes a village. This really is a lot of people at the federal, state, and local level coming together for an incredible life-saving mission. And we're having huge success. I think the county executive and I were just talking about the more positive, more hopeful feeling that we're getting as we're out talking with constituents because we've done 3.2 million vaccines and 78% of all the people over 65 have already been vaccinated. 46% of all Marylanders over the age of 18 have already received a vaccine. And thanks to the 12 mass vac sites, our other 3,000 points of distribution, and now this incredible FEMA-supported facility here in Prince George's County. We're just going to continue to finish working on this job until it's done, until every single person in Maryland that wants a vaccine is able to get one. And so look forward to hearing from the other partners, but I want to thank every single person, not just the ones that are standing up here, but every single person on their teams and in their agencies that all work together. It's truly a partnership, and I just want to say thank you to everybody involved.
Good morning, everyone. This really is a wonderful day in Prince George's County. I want to begin by thanking the governor for his leadership and thank him for being here. I always enjoy welcoming him back home because you all know Prince George's County is his home. So I want to just welcome him and thank the entire state team for the partnership that we've shared, the governor over this pandemic. And we are just so excited. Today does represent for us another ray of hope. For our residents who have yet another place to be vaccinated and to have the hope that they can be reunited with their family members safely and can move back to normal life. And so last week alone, we vaccinated over 52,000 Prince Georgians. And this site, which offers 3,000 shots per day and has reserved 65%. And again, I do want to thank the governor and his team for reserving 65%. Thank FEMA so much for coming to Prince George's County and allowing us, Prince George's County, which was the hardest hit jurisdiction in the state, to protect our residents and to move back into normal life. I also really want to thank Mayor Colin Byrd, who is here. I also want to thank Emmett Jordan, who is here from the council, for their leadership, and to say that this site represents for us increased accessibility. General Burkhead, thank you so much also for making sure that every single Prince Georgian, without respect for your resources, has an opportunity to be protected. This one, as you know, is here with transit. So many of our residents who do not have cars are able to access this site. Many of in the inner beltway areas who have said, well, how do we get our shots? Well, they can come here now by way of Metro and get those shots. We're also increasing the penetration into those hard to hit communities through our mobile units. So getting the vaccine directly to the bedside in many cases of those who can't make it. But this site represents for us yet another chance to do so. So we're really just ecstatic today. 4 days it took to erect this beautiful site. That's unbelievable. It's magic that was performed here, and we recognize it, and we're just really grateful.
Governor, just wanted to thank you for your leadership. It's the governor's passion that has been pulling us together to move forward. So this is an exciting day. The only thing I'll say is that it took us 67 days to get 1 million shots. It took us 27 days to get the next million, and another 19 days to go over 3 million this week. So as I've said many times, we have the dual responsibility of speed and equity. We're getting the speed there, and here in Prince George's County, we're very focused on the equity. And so it's really critical that we maintain that balance. And this site, thanks to FEMA, putting it here, and all the staff from all the partners, we're expecting our numbers to grow dramatically. So thank you, everybody, and thanks to all the partners.
Governor, County Executive, glad to be here with you today. This is where whole of government meets equity. This was intentional, working with FEMA, our county partners, the state, MDH, to decide that this facility is the right place. Transportation is an issue. The county executive addressed that. This gives us access for a whole of Prince George's County, and then driving those numbers to equity and getting people here in the community where they live. So thank you for your leadership. Thank you, FEMA. Appreciate being a partner here. Looking forward to working together. Thank you.
Thanks, General. And as you mentioned, expanding access to the vaccine is vitally important. And what a great site to help do that here at Greenbelt Metro Station. I do want to thank our partners at FEMA, Prince George's County, Greenbelt, for helping rapidly stand up this site. It really is a true federal, state, local collaboration, which is one of the tenets of emergency management, coincidentally enough. So as others have said, there'll be 2,000 vaccinations today and then 3,000 tomorrow. That's the great thing about mass vaccination sites. We have economies of scale and efficiencies. They're excellent at getting shots in arms, many shots in arms. In Maryland, we're doing about 100,000 vaccinations per week at the state mass vaccination sites. And under the governor's direction, we'll have 13 open by the end of this month. It's a great thing. Thank you.
So good morning, and thank you, Governor Hogan, and all of our federal, state, and local partners that have come together to open this joint community vaccination center in Greenbelt. And it is a true feat that this was put up in 4 days, and I'm truly excited about the teamwork that's been happening here. The goal of establishing these joint federal pilot centers is to continue to expand the rate of vaccinations in an efficient, effective, and equitable manner, with an explicit focus on making sure that communities with a high risk of COVID-19 exposure and infections are not left behind. I am truly honored to be here at Prince George's County. FEMA is working closely with our local and state partners to support all efforts to reach these communities through targeted outreach to community-based organizations, local media, radio stations, and our private sector partners. Just a couple of things about the site. At this site, those administering the vaccine have been trained to ensure a positive experience for everyone. The site has signage with directions for clients with access and functional needs and non-English speaking clients. There is an assisted check-in area and process for clients with access and functional needs. There is an on-site translation in American Sign Language, and we will also have Spanish, French, and a few other languages to help interpret. Wheelchairs are also available. This administration's view is that everyone should have access to safe, effective, cost-free COVID vaccines, regardless of their immigration status. Getting our communities vaccinated keeps us all safe. FEMA has partnered with the Department of Defense to provide both administrative and medical support during these vaccination missions. We have here in this location a total of 135 Air Force and Army personnel that are supporting this mission here. I want to assure clients that medical personnel in Armed Forces uniforms are helping to administer the vaccine. They are not here for law enforcement purposes. Over the next 8 weeks, this Type 2 site is projected to administer 3,000 shots a day to eligible Marylanders, primarily from Prince George's County. We are now waiting for vaccine. We know waiting for the vaccine has not been easy. but it's critical for you, your loved ones, and your community to save your place by registering today, either online at coronavirus.maryland.gov/pages/vaccine or calling 855-634-6829. Throughout this entire vaccine mission, we've been fighting two enemies, a virus and the inequities it has exploited. Establishing the site will help us reach the underserved in Prince George's County and bring us one step closer to winning the war against COVID-19. Our mission is helping people before, during, and after disasters. Equity is not a side note in our mission. Equity is the core of that mission. And the end of this pandemic is within reach. Everyone has to get vaccinated to make that happen. Even if you've had your shot, I urge you to reach out to your family and friends and make sure they've had theirs. We are truly all in this together. Thank you.
So first of all, good morning, ladies and gentlemen. Can you guys hear me? Okay, sounds good. And I don't know. Okay. So I just want to start by saying from Mandan Road to Old Greenbelt to Franklin Park to Greenbelt Station, this is a great day for the people of Greenbelt. But I want to go back to how this began. From the early days of this pandemic, Prince George's County has been the hardest hit jurisdiction in the entire region when it comes to this pandemic. And from the early days of the vaccine being rolled out in the state of Maryland, this state has unfortunately been one of the most inequitable in all of America when it comes to vaccine distribution. It has been particularly troubling for Prince George's County because we are a county that has a disproportionate number of residents who have pre-existing conditions. At the same time, the state's highest ranking elected official has unfortunately subjected people of color and people of all backgrounds in places like Prince George's County and places like Baltimore City to claims of over-entitlement. And while people of color in this county and all across the state continue to have a high demand and a high need for the vaccine, the state has chosen on many occasions to scapegoat people of color across the state as people who simply do not want the vaccine. Nothing could be further from the truth. The reality is that while there are some people of color and people of all backgrounds who have had concerns about the vaccine, scores of people of color and people of all backgrounds who want the vaccine have had heartbreaking difficulty getting the vaccine because of the state's extremely inequitable rollout, because of major flaws in the state sign-up system, because of mass confusion, and because of the fact that people have had to wait in extraordinarily long lines for extraordinarily long times. Today, however, marks a significant turning point when it comes to equity in the distribution of the vaccine for the people of Maryland and for the people of Prince George's County. With the support of FEMA, I'm delighted that Greenbelt and more broadly Prince George's County is today becoming ground zero for the Biden-Harris administration's commitment to improving the equity of vaccine distribution in the state of Maryland. I want to note that it should be noted clearly that once again, this is a federally run community vaccination center that is community-based. So I also want to specifically express my gratitude to our federal legislative partners, especially Congressman Steny Hoyer and Congressman Anthony Brown, both of whom specifically pushed for a FEMA-run vaccination site in Prince George's County. I also want to express my gratitude to President Biden, Vice President Harris, and Administrator Barlow for collectively recognizing that this site is the prime location within the county in light of its proximity to the metro station, parking access, transit accessibility, and the issue of the equity. I do want to note as well that, as has been mentioned previously, yesterday was a soft rollout for this site. And I want to especially commend FEMA and our federal partners because I received anecdotal feedback from several of our constituents who said that the job that they did and hopefully will continue to do was fantastic, seamless, and very convenient. So I'm grateful for that. But I want to close on this note. Today, as I said, is a watershed moment for the county, for the state, and for the country. But I would be remiss if I close without acknowledging that I think as important as it is that we're taking this step when it comes to vaccine distribution, we also take a broader step in this state, in this county, and in this country towards moving from pandemic denial to pandemic truth. Now, what do I mean by that? Let me just say this. I am grateful to Governor Hogan for visiting Greenbelt today and for his remarks. But while I'm grateful for his remarks about combating the pandemic and fighting this virus, I want to let you know, Mr. Governor, very respectfully, that you have reopened the state, in my mind, far too quickly. And I ask that you reinstate more reasonable restrictions as soon as possible. Literally just yesterday, the administration, the federal government's CDC director said that with some of the state reopening timelines that have happened over the last few weeks and months, we could be looking at impending doom. We could be looking at a fourth wave. We could be looking at more people getting sick and more people dying. And since the state reopened last month, there has been a significant and marked increase in COVID-19 cases. When the state was reopening, the governor indicated that he would follow the science. But since reopening the states, we have seen the exact opposite. We have seen pandemic denial, and we have seen claims that the rise and the uptick in cases is unrelated to the accelerated reopening. We have also seen the hiring of a Trump administration officials whose credibility on the vaccine and on the pandemic in general is widely in question. And I fear that as a result of that, and as a result of the reopening decisions that have been made, more Marylanders will get sick and more Marylanders will die. And so I want to use this opportunity to say that I hope that the state reverses course. Even though Prince George's County has kept in place many restrictions in spite of the state's actions in March, the state level reopening decisions impact our residents as well, because people from other counties travel to and from our county every day. Finally, I'm very grateful to the county executive, Ms. Alshabrooks, for visiting Greenbelt today and for her remarks. And I'm especially grateful to her for her leadership when it comes to advocating for more equity in the distribution of this vaccine and for more restrictions to keep the residents of this county safe, to get more residents in this county vaccinated. But I do want to say this for the county executive to consider. Literally today, a resident of my city, Ms. Chrissy Wilkins, who happens to be a teacher, is holding a rally at Eleanor Roosevelt High. And she's holding a rally at Eleanor Roosevelt High because teachers in this county have specifically expressed grave concerns about the timeline for the county's plan when it comes to reopening our schools in terms of physical reopening. And so I want to stress that I support Ms. Wilkins. I support the other Greenbelt residents and teachers within this county who are advocating for this county, the schools in particular, to take another look at its timeline and to only reopen when it's safe. There are concerns that have been raised, for example, about ventilation. I literally received, I'll wrap it up in a second, Mr. Governor. You're in my city, good sir.
Yeah.
So with that, the second thing I'm going to mention is that I literally received allegations this morning. That the county specifically changed the criteria that would be used for what constitutes safe reopening for our schools, taking it from 10 cases to 100 cases. I want to make sure that that's plainly articulated for the record. And this is in spite of the fact that our county continues to be the county with the lowest percentage of fully vaccinated residents. So I close on that, and I close on this. I want to say to the people of Greenbelt, I want to reiterate, as I always have, that I mean it when I say that I love the people of Greenbelt. I will always do everything in my power.
We have another event.
Thank you very much. Okay, you can definitely go to another event. I love the people of Greenbelt. I will always do everything in my power
I gotta cut
to
this.
make
We
sure
gotta
more Greenbelt.
Sorry, sir.
Excuse me, sir. Excuse me, sir. To make sure more Greenbelters are vaccinated more quickly, more easily, and more equitably. And I will always do everything in my power to help us win this fight against the pandemic. As always, thank you for allowing me to serve you. And if you ever have any feedback, questions, or concerns, you're welcome to contact me anytime. Thank you.
All right, thank you very much for your time today.
We'd be happy to take a few questions from the media. Maybe we'll wait for those helicopters. Looks like more reinforcements coming in. Thank you.
In terms of pre-registration, there's been a few folks who have been able to pre-register for the mass vaccination site and been able to get it in a few days. There's been folks who have waited a month and are still waiting. Could you explain for folks who are waiting patiently why is that?
Well, anybody that was registered before, there's only a few that are left from phases 1 and 2. Only 24% of the state population has not been vaccinated. But we just had 600,000 some people pre-register on the state site just in the past few days. And it's gone very smoothly. We're filling up all the appointments at all of our sites all across the state. And we're just getting that increased supply from the federal government, and it's going to continue. We're looking forward to getting everybody a shot as soon as we can.
Governor, with regard to the Salisbury mass vaccine site, there are claims circulating today that it's so underutilized that there are doses being disposed of. Do we have an answer about that?
I'm not aware of anything like that, no. I think that's false.
Okay, and then secondarily, Hagerstown yesterday, the first day of lockup, I guess there was some...
It went very well.
What's your advice to people that want to...
My advice, as I said at the press conference, was everyone should pre-register on the state site and be guaranteed an appointment. We said we'd open up a limited number of walk-up appointments, but that you couldn't be guaranteed to get one because we don't have an unlimited supply. So they filled all the appointments yesterday at Hagerstown. They had 250 for anybody who walked up, and they used every one of them. And some people, unfortunately, got turned away. That they should probably just schedule an appointment so they can get that taken care of.
What do you make of the D.C. officials? I know at least one asked D.C. residents to get registered here and to come here. And then I also want to make sure that if you want to respond to what Mayor Bird said, that you...
I don't have much to say to what the mayor said. I would disagree with every word that he said. The Biden administration twice this week praised us as having the best equity effort in the entire country out of all 50 states. We're 15th in the nation in the rate of vaccinations. We've had a tremendous effort. I think it denigrates the incredible partnership we've had with Prince George's County and with our equity task force led by General Burkhead. I can tell you the mayor has had nothing to do with our vaccine effort or this site and didn't have any idea what he was talking about.
Oh, and about the D.C. officials?
D.C. officials, I don't know what the D.C. officials said, but I know that the real focus here on the part of FEMA and the state is working with them on their registering of people that we're committing. 65% of appointments go to Prince George's County residents. Another 25% go next door because this is an effort to also reach inequitable, underserved communities just over the border in Montgomery County. So 25% go to them. So, it is a federal asset, and I think they won't turn away somebody that tried to register from D.C., but it's a very limited amount. 90-some, close to 99% of the people are going to be Maryland residents.
So, we understand that there are lots of concerns that our teachers have, and those concerns are warranted. This virus took the lives of a few of our teachers, especially at the beginning of the pandemic. But we have worked hard to make sure that all who returned to the classroom had access to the vaccine. We worked with Dr. Golson, who I think did a really beautiful job of offering the vaccine to our school system employees. In fact, out of the 20,000 employees who we have in the school system, initially just 9,000 of them agreed to receive the vaccine. After we worked with the school system, we saw that a little over 10,000 of our school system employees have agreed to have the vaccine. We worked quickly to make sure we vaccinated all of them. But we understand that even in spite of that, I think Dr. Golson has been exceedingly cautious. She cares about, and I care about, every single member of our school system, from the bus drivers to those who work in our cafeterias. But she worked to make sure that we've been cautious. In fact, we are coming back to the classroom later than was requested. And that was okay. Our state superintendent was very understanding, worked with us to make sure that we came back once everyone had the opportunity to receive the vaccine. But we know that there will still be fears and concerns. We respect that, and we'll do everything we can to make sure that it is safe for our teachers. We've also put in new air purification systems throughout our school system. So Dr. Golson, our school system has done what they could to make it safe, but we do respect and understand that people are still concerned about passing on the virus to family members. And did you ask me to respond? I'll also respond. I think you were asking me to respond as well. So what I'll say is this: as public officials, it's our job to deliver solutions. That's what today is about. We understand that we have a pandemic that we are working against, and I want to again thank the state. We thank the federal government. This is a beautiful example of what that collaboration produces in 4 short days as a result of continued partnership. General Burkhead has worked exceedingly hard. She's talked to us every single day in Prince George's County to ask how they can provide more equitable solutions to getting this vaccine out. And I've said it before, I'll say it again. It does not take talent to spot a problem. I wanted to say that. It does not take very much talent to spot what's wrong. It takes much more talent and commitment to fix it. And we're here today to fix it. And so I think Prince Georgians share my feeling that we just want to get our families protected, and that's what this gives us another opportunity to do.
Dr. Hogan, can you give us an update with your latest conversation with the White House about the supply of vaccine that's coming in, and they have an update on when we may see some Johnson & Johnson doses that were made in Maryland?
What was the second part of the question, Kate?
An update on the vaccine supply general and the Johnson & Johnson supply, the doses that were manufactured.
Yeah, so we got some very concerning news just last evening from the White House. They had assured us up till Thursday that they were going to continue with the supply level that we had been getting each week. Of course, yesterday the president had the announcement about trying to get states to speed up to kind of catch up with where Maryland had already announced where we were going to be. We fully expected to get a full same kind of number of Johnson & Johnson as we normally do. We were informed last night that they're going to cut the allocation to all the states by roughly 5 million doses, from 500 and I think 5.8 million to 600,000 nationwide, which for us means about 80,000 fewer doses of Johnson & Johnson for this week, and we just found out about it last night. The good news is that thanks to FEMA coming in and doing 21,000 shots a week here, that's out of a federal supply, which we greatly appreciate, and some slight increases in Pfizer and Moderna, that gap is not going to be as wide. It's going to be we're going to be about 40,000 shorter than we expected. But we anticipate that we'll be able to manage all of the appointments that are scheduled and continue. It's a little bit of an issue we're scrambling to try to correct. I don't know the reason for it. Nobody's really given us a good explanation. They had just assured us on Thursday that there was going to be no interruption of the Johnson & Johnson supply, regardless of the emergent biosolutions issue. They were coming from different places. I don't really have a lot of clarity on why, but we're gonna work together with our partners and try to work our way through it. And they've assured us that that's going to get improved, and by the end of April they'll be back to where they were supposed to be.
And just to clarify, the 500,000 fewer, that's just Johnson & Johnson? Will it
Just Johnson & Johnson was cut from 5.6 million, I think, to 600,000 nationwide. So we get about 2% of the doses. We get about 11,000 instead of almost 90,000.
Last question.
Anybody else? Thank you.